I hope everyone is doing good today. So I know I have this on Facebook as planned at 1 o'clock. However, I it was a error, so I will be going live right now. I'm going to give it about 10 minutes so it can show up that I am live. But I'm pretty sure that everyone is going to catch this afterwards anyway, so it shouldn't be a big deal. You know. So I'm gonna give it about 10 minutes just so it can, show up on Facebook and YouTube that I am live, just in case anyone wants to catch the show live. But if not, that's okay too. We will get started at 12:15. Okay, so if you are seeing this, we will get started at 12:15. I have some valuable information for you today. Hopefully, it'll be, a asset to your life, something that you didn't know before. We will be talking about mobile crisis teams, so I'll let you know all about what mobile crisis teams are, what they do. Does your state have one? So this is a very important topic. So, and I just want to let you know beforehand that it will be suicide will be mentioned. So we won't go into suicide because I know some people don't like to hear that word. But me as a therapist, of course, it it's a word and it's something that needs to be talked about. But we won't actually go into talking about suicide. We talk about how if you're experiencing these thoughts related to suicide, how mobile crisis teams, will be of assistance to you. So that will be the scope of what we will say on that topic. But I just want to let you know that it will be mentioned, and I know that is a trigger for some people. So, okay, so let me. I'm gonna give it. We'll start at 12:15. So we got about 9 more minutes, and we'll go from there. All right. See you soon. Just let this music play until I get back. Okay, we're back. We're back. All right. So, like I said, I just wanted to give some time for some people to catch the stream live. I know I had a different time um, on my Facebook page, so there was that. That's why I'm getting started a little later than usual. Okay, so we will get started. So, as the title says, what are mobile crisis teams and does your state have one? So, like I was stating earlier, if you caught that, it is just going to be some valuable information, maybe information that you did know, hopefully, because I like to, give valuable information. And if you already know it, of course, it's not too valuable. So, we're going to get started. Let's see. All right, so let me just share my screen so we can get started with what I want to share first. Hold on 1 second. So I want to this one. Okay, so our first, what we're gonna. Oh, there it is. Um, okay, share this. Okay, so what we're gonna talk about first is basically what is so mobile crisis teams, right? So we're going to talk about what a crisis center is. So this would be if, for example, the mobile crisis team did come out on the scene of, let's just use if someone was having a mental health crisis, right? And so instead of the police being the only personnel there, the mobile crisis team would also come out as well. And from that point, they would be assessed through a crisis center. So we're going to go through what a crisis center is. Hi, Leo. Thank you for joining us today. Um, Thank you so much. Hopefully, you'll learn some valuable information here. Thank you for being here. Okay, so it says, what is the crisis center? First of all, before we even know about the mobile crisis team, we need to have more information about, you know, what a crisis center even is, right? So it says a crisis center is a resource. It's a resource for individuals going through mental health crisis. It kind of self-explanatory a little bit. That part is because we know, it kind of makes sense. It's in the title, crisis center, so it is someone who's gone through a mental health crisis. But so we know that part. So let's go through exactly what that entails, and just stay with me because I have a lot of information to give today. So it says they provide mental health services and emotional support for their state or local community. Most crisis centers are nonprofit, and many utilize trained volunteers as well as mental health professionals. Your local crisis center usually serves your entire community, is often 24/7, and also free of charge. So remember, those are three key things, right? So it's supposed to serve your entire community. It's supposed to be available anytime you need it, and also it shouldn't be charging you any money. These centers connect callers to providers in their community that can support their needs. Crisis centers answer calls for the lifeline as well as low helplines and offer other resources such as text, chat, or mobile services. Crisis centers also provide training and educational resources on suicide prevention and mental wellness. And if you were here at the beginning of my life, I did do a trigger warning stating that suicide would be mentioned in this live. But we won't get into, talking about suicide per se, but it will, as I'm explaining what the mobile crisis team is, um, it will relate. I mean, I will talk about that it is for, I'm trying to say this correctly. So it is for individuals who may have suicidal thoughts. So that's where the talk of suicide will come in at. So I just want to give out that trigger warning. Okay, it says, So they are also a resource for mental health professionals seeking advice on best practices. See, that's something I didn't know that. All of the services a crisis center offers strengthens their local community and the state as a whole. And if you just hang around towards the end, I'm gonna also go into what states offer this service. So it states the National Suicide Prevention Lifeline is made up an expansive network of over 200 local and state-funded crisis centers across the United States. The counselors at these local crisis centers answer calls and chats from people in distress that the Lifeline receives every day. The Lifeline's crisis centers provide the specialized care of a local community with the support of a national network. Okay? So it says the Lifeline's United Network provides at-risk individuals across the country with a single well-known phone number and name. This unity enables the Lifeline to assure that centers are accredited, provide training for counselors, and disseminate best practices. Calls to the Lifeline are routed to their closest center based on area code with the goal of connecting callers to counselors in their own state. Local counselors at crisis centers are familiar with community mental health resources and can therefore provide referrals to local services. Okay, so it says, why crisis centers need your help. The National Suicide Prevention Lifeline is an effective life-saving safety net for those experiencing mental health crisis, as shown by research. Although the Lifeline is a national program, the funds that sustain the network crisis centers come from state and local contributors. Many of the crisis centers in our network require more funding and resources in order to continue operating and growing. So that's just a, if you would like to donate to one of these, um, to the suicide prevention lifeline, you can just Google it and you would find more information on that. Crisis centers are a key component of mental health care within each county and state across the United States. The centers act as a safety net for those at serious risk, especially those with nowhere else to turn. So the reason I'm mentioning the centers because they tie in with the mobile crisis team, as you will see as as we go along. So I just want you to pay attention and stay, hold on, and I'm gonna tie it all together. Okay, so I just want to play this video. Hopefully, I can play it. I know YouTube is very picky about things, so all right. All right, let me see if I can make this screen clear. See. Let me see if I can make the screen clear. Um, let me stop sharing. I'm not sure if I can make it clear or not, but I will definitely try. Let's see. If this is better. Is this better? I'm not sure if you're still here or not, Leo, but I just want to know if it's better because I'm getting ready to play a video. So I'm going to turn off my music for a second while I play the video. And let's see. And thank you for letting me know that. I wasn't aware that you couldn't see it. So thank you so much for that. All right, so let's play this video. Let's continue on. Go back to. All right. Okay, so I hope that the video is very informational. Hold on one second, trying to send a text. All right, so all right, so let me get my music back on and go to our next bit of information. So, so we just watched a video about um, what a crisis center is. So next, we're going to go into now this is this is going to be very informational because this is going to go into the law which enacted these mobile crisis teams. Um, okay, so this is going to go into the act that it's going to go into the let's see the bill that was passed to enact these mobile crisis teams that many people may not know about. Because if you recall, well, not if you recall, but we'll just talk about the many lives that have been lost because when the police show up on the scene and they may or may not be trained in mental health crisis, and it escalates into a whole nother issue many times with the person being killed. So these mobile crisis teams, instead of the law enforcement showing up when if someone is in a known mental health crisis, these mobile crisis teams will show up with law enforcement. So now we're just going to go into more about this bill that was passed to allow this to happen. And this is monumental because I know a lot of people advocated for this type of for this type of for this to happen. So this is kind of monumental. So let's just get into it. So you understand more what I'm talking about. We're gonna go right. So got that. I'm gonna go right here. Make it bigger. Make sure everyone can see it. Okay, there we go. All right. So we're gonna talk about. We're gonna talk about. This is from. Let's see. At the right, you can see Princeton University. At the top is State Health and Value Strategy, a program supported by the Robert Wood Johnson Foundation. This is written on April 30th, 2021. The title states the American Rescue Plan provides a new opportunity for states to invest in equitable, comprehensive, and integrated crisis services. Okay? And this was written by Ashley Trio, Patricia Buzane, Jocelyn Dyer, and Lynette Tell. All right, so let's just get into what it is. It's going to be quite interesting because I'm pretty sure a lot of people did not know it existed. I know I sure did not. So it says the American Rescue Plan, also known as ARP, Act, enacted on March 11th, 2021, so a little over a year now, establishes a state option to provide community mobile crisis intervention services for a 5-year period beginning in April 2022. So you guys, this act is in place right now. It's been in place for the last couple of months, and it's gonna be in place until 2027. So it states as an incentive to state adoption, the law provides for an 85% enhanced federal matching rate for qualifying services for the first 3 years of state coverage. So we're going to go through a lot of technical stuff right here, but we're going to get down to the information that you need in a few minutes. So it's got to cover all of it though. It says to further encourage states, ARP also includes $15 million $15 million in state planning grants to support their efforts to develop a state plan amendment or waiver request. And that says, e.g., Section 1115, 1915 B, I mean, parentheses B, not parentheses, B or 1915 B, to take up the option. The new mobile crisis prevention arrives just as many states and localities are exploring strategies to address the worsening behavioral health, mental health, and substance use disorder crisis. So let's just look at box one right quick. So it says box one, behavioral health needs across states. Drug overdoses have surged to their highest level. More than 87,000 Americans died, an annual increase of close to 30% from drug overdoses from September 2019 to September 2020. Adolescent mental health is worsening. Among adolescents aged 12 to 17, the percentage with a past year major depressive episode increased from 9% in 2004 to 15.7% in 2019. However, suicide rates declined for the first time in 20 years. After increasing from 1999 to 2018, the age-adjusted suicide rate in 2019 declined significantly from 2018. Okay, so I just wanted to read that box for you. So it says there is basically exploring since the new mobile crisis provision arrives, just as many states and localities are exploring strategies to address the worsening behavior health, mental health, and substance use disorder, as well as preparing for implementation of 988, which is the new national hotline for behavior health crisis. So I don't remember, I don't I don't know how many people were have watched. I think that was maybe my first ride, and I talked about the implementation of the new mental health crisis hotline. So if you or your loved one was having a mental health crisis, you no longer call 911. Is a new number. It's 988, and then that means when you call that number there, you're not looked at as a suspect, right? You're looked at as someone that is in active mental health crisis. And so that way they can distinguish, okay, um, they can distinguish the behavior. So it no matter, what the behavior look like, you're calling a specialized line for that active mental health crisis that's going on, if that makes sense. And I will do another. I think the 988 number will come into effect in July, and I will do a live about that. As time gets closer, so you can have all the information that you need. Okay, so there's that. Let's see. Let's go back. So it says for states and localities reviewing their policy procedures. Just give me 1 second. Okay, so it says for states and localities reviewing their policy, policing procedures, the new option also could be used to support state efforts to refine the role of law enforcement in responding to behavioral health crisis, offering more resources to the police on such calls, or in some instances, even entirely avoid the need for law enforcement. So that's kind of like what I was saying earlier about this new number 988. It takes, in most cases, in some cases, it will remove the need for law enforcement, because let's just face it, if someone is having a mental health crisis, it's nothing unless the law enforcement official has been trained in mental health issues. It's nothing they can do. They can eat, they can only take them to jail. But if someone's in active mental health crisis, let's be real, do they need jail or do they need to be stabilized? Right? So this is very monumental, because with the implementation of the 988 number, if someone is in mental health crisis, they will no longer be escorted out to jail, right? So just want to get that across. And like I also just stated, just in case you're just coming on, that I will be doing a live about the 988 number, which will come into effect in July, and give more information on that as well. So as you see here, sometimes um, you'll even be able to totally avoid the law enforcement, because if you're having a mental health crisis, you don't need to go to jail. You know, I mean, this is out of your control. All right, so, but just keep in mind, of course, it has to be deemed a mental health crisis, because the mental health professional is going to come out and make sure. So we're not just saying that anybody can say that's what's happening, right? They will be assessed on the scene. Okay, so I'm going to read the rest of this, but before I read the rest of this, I want to show you a video, and I just want, I'm not sure if everyone has seen this. I just want to show you a video of what happens when when the police are called out on a scene and someone is in active mental health crisis, and the police is called out instead of a trained mental health professional. And of course, we have many cases where this has happened. So this is just going to be one of those cases. Okay, so let me stop sharing this. All right, let me stop sharing this. And share my screen and share this. Like I said, this is just one of the cases. I did get a notice that my screen is kind of hard to see, so I'm not sure everyone able to see it. Okay, here we go. Okay, so basically, it says Texas man fatally shot by police doing mental health check. Family for officers arrest. It says Texas man fatally shot by police doing mental health check. Family checks for officers. Family calls for officers arrest. The family of Patrick Warren Sr., a black man, is demanding that the Killeen police officer Ronaldo Contreras be arrested for the Sunday shooting. And before I go any further, yes, I know they say a black man, but this could happen to anyone. Anyone that's in mental health crisis, and the police show up and they don't understand the scope of the issue, or someone dealing with mental health crisis, does not matter the color, right? But I'm just reading what it's here. So it says he was killed January 10th. I'm not sure if everyone um, um, knows about this. I'm not going to go into the video, it's a little intense, but you see his name. So if you wanted to Google, it's definitely there. So this is the article from NBC News by Minnie Von Berg. So it says the family of Killeen, Texas man fatally shot by police in the front yard of his home doing a mental health check is calling for the officer's arrest. The shooting happened Sunday just before 5:30 p.m. when the family of Patrick Warren Sr., a black man, called police to ask that a mental health professional be sent to the home. Instead, an officer who was not prepared to handle mental health crisis responded to the call. Civil rights attorney Lee Merritt said at a press conference Thursday afternoon. Merritt, who is representing the family, said the officer's demeanor was hostile and he quickly escalated the situation. The events leading up to the shooting remain unknown. The Killeen Police Department said that Officer Ronaldo Contreras was sent to the home in response to a psychiatric call. When Contreras arrived, he encountered an emotionally distressed man, according to a police statement. The officer used his conducted energy weapon on Warren, but it was not effective, police said. He then used his gun, striking a 52-year-old man. Warren died at a hospital from his injuries. Killeen police have not said why Contreras fired his weapon. The department did not return a request for comment Thursday, and Contreras also could not be reached. The Texas Rangers, which is handling the investigation into the shooting, said that any additional information would be coordinated by the district attorney's office and the Killeen Police Department. The moments before and after the shooting were caught on video. And video captured by a Ring doorbell camera, the officer knocks on the front door and is told to come inside. After a few minutes, Contreras leaves the home, followed by Warren, who is waving his hands in the air. The officers hurry asking Warren to get down on the ground. Someone in the home yells for Contreras to not shoot. Warren walks towards the officer and out of view of the camera. Another video, apparently filmed on a cell phone, shows Warren gets up off the ground and walks forward out of view of the camera. A man yells for Warren to sit down. Several shots can be heard in the video. No, I told you don't use the gun, the man screams. Mary said that the family had called police on Saturday, the day before the shooting, because of a mental health concern involving Warren. A mental health resource officer responded, and Warren voluntarily agreed to go to the hospital for evaluation. He later returned home. The family called police again the following day because they were still concerned about Warren. Mary said they asked Contreras to leave because they wanted the resource officer who had previously responded. There's no reason that a mental health call like this should result in a fatality. Mr. Warren was not aggressive. Mr. Warren was not armed. He was in his home. He was on his lawn. He was within his rights to reject the services of law enforcement after they arrived, the attorney said at Thursday's press conference. Their responsibility was simply to leave or send the appropriate personnel to deal with this particular crisis. They failed this family in every way and left them shattered. Warren's wife, Bobby, said her husband had lost his job at a local plant because of the coronavirus pandemic. He had started a landscaping business so he could provide for his family. Patrick was a loving husband, father, and a devoted man of God. As we deal with the pain of his sudden loss, we are asking the community to join us in honoring his name and demanding justice, she said in a statement shared by her attorney. Contreras, a 5-year veteran of the Killeen Police Department, was placed on administrative leave, which is standard practice in officer-involved shootings. Mary said the officer should be arrested immediately. Killeen Police Chief Charles Kimball said there would be a thorough investigation into the shooting. The police department is also conducting a separate internal affairs investigation. This incident is rightly of great concern to the community. As Killeen Police Chief, it is my duty to ensure a thorough investigation is conducted so that all parties, including the public, have the answers they seek. There are many more facts in this case that are not publicly available at this time, he said in a statement. I assure you that more information will be made available as soon as appropriate, and I ask for your patience as both investigations proceed. Okay, okay. So, uh, what do y'all think about that? What do you think about that? So that go So that goes back to why these mobile crisis teams, that's a prime example, even though this is happening over and over again, right? But that's a prime example why we need these mobile crisis teams to show up instead of law enforcement. Because more times than not, these law enforcement have not been trained in mental health issues. For example, myself, I went to school for a lot of years to become a mental health professional. I'm very equipped to notice certain diagnoses. Well, pretty much all diagnoses. So I'm very equipped to do that. But law enforcement officers, they don't go to school to handle mental health crisis or to even know what they look like. So it's very dangerous when you're calling a law enforcement officer over to handle someone in active mental health crisis. So that just goes back to our point how important these mobile crisis teams are going to be moving forward, right? Okay, so I just wanted to show that example. And like I said, that is happening over and over again. That is just an example of what can happen when these law enforcement officers are called out on a scene involving active mental and active mental health crisis. Okay, so I'm going to continue on. Oh, okay. So let's continue back to our to the what I was reading earlier, the American Rescue Plan. I just wanted to show it in real time what it looks like when law enforcement is being called out on a scene to someone that's had active mental health crisis. All right, so let's get back to where we were. I just want to make sure you can see this. I did get a message saying that it needed to be clear. Okay, here we go. So let's see. So it says, where are, okay, so we talked about a little, we have got into the crisis center. So this crisis center is where someone would be referred to if they were, if the mobile team was called out to the scene of someone dealing with an active mental health crisis instead of law enforcement. So now we're going to talk about the services of a community mobile crisis. So what are community mobile crisis intervention services? So basically, if the crisis team comes out on scene, this is the act. This is what should be included when a you or a loved one and is experiencing this, right? And so the team is called out on scene. This is the law. This is what should be included with your services, basically. Okay, so let me read it. It says community mobile crisis intervention services are a critical part of state's crisis and behavior health system of care. The Substance Abuse and Mental Health Services Administration, also known as SAMHSA, National Guidelines for Behavioral Health Crisis Care distill the elements of a crisis system into three core components with linkages to broader behavioral health continuum of care. So that means this you will receive this, but also you will also have resources to even uh, higher care. Okay. So it says regional or statewide crisis call centers coordinate in real time. So you should have a crisis call center, statewide crisis call center, or it can be regional, that you're able to call in real time. Centrally deployed 24/7 mobile crisis and 23-hour crisis receiving and stabilization facilities. It says using this model, the regional or statewide crisis call center charges uh, okay, using this model, the regional or statewide crisis call center triages a call and dispatches a mobile crisis unit to respond to an individual in crisis. Mobile crisis teams comprise of qualified professionals that are trained to de-escalate and treat individuals in crisis, work to assess and stabilize individuals experiencing behavioral health emergencies in the least restrictive setting, and divert individuals with mental illness from jail and emergency departments to crisis receiving and stabilization facilities and other community-based treatment. So basically, what it's saying is that an individual who is having a known mental health crisis, taking, instead of law enforcement taking them to jail, they will be assessed and stabilized by mental health professionals in a least restrictive setting. And I'm assuming that means um, not handcuffed. Well, I guess in some cases you may have to handcuff, but it will always be done to be in the least restrictive setting as possible. And instead of these individuals going to jail, they will go to crisis receiving and stabilization facilities and other community-based treatment. So they would no longer individuals who are having these active mental health crisis will not be sent to jail. All right. Mobile crisis teams enable states and localities to begin to shift away from relying heavily on police, many of whom are insufficiently trained in behavioral health crisis, to other trained first responders. So that's basically what I was saying earlier. That many, and I'm not saying any. Let me just do a quick disclaimer before I go any further. So when I say that law enforcement are not equipped to handle mental health crisis, I'm not taking anything away from our law enforcement. I love our law enforcement officers. If it was not for them patrolling and making sure the streets are safe, this world, well, this country and the world, because we have police law enforcement officers all over the world. This place would be a jungle. So I'm not taking anything away from them. But I think it's even unfair of them to even have to show up on the scene of someone that's having a known mental health crisis, knowing that they're not fully equipped to handle this service because they have been trained to govern the law and make basically um, uh, focus on criminals. But someone that's having a mental health crisis, they're not criminals, right? They're having a mental health crisis, and like I said earlier, this will not be taken lightly because you cannot just tell me that this is what's going on, and I say, okay, listen, you're not going to jail. No, you will be assessed on the scene by trained mental health professionals. So once it's determined that's what's happening at that time, you will then go to a some sort of stabilization place instead where you can get your medications, therapy, or whatever you need instead of going to a jail, which I think is fair. Because I think as a mental health professional, I think a definitive line does need to be drawn there uh, between uh, the police and the mental health professional, because police are not trained in that. They don't go to school for that, right? They're not trained in those issues. As a mental health professional, we go to school for years and years and years. Okay, so my colleagues, we're trained in noticing active mental health crises. We have been trained for this, so I think this is gonna be great because And then that's going to keep a lot of these individuals out of jail. Where even though if they go to jail, they do receive their medications, but I just don't believe that you know that they should even be in jail in the first place. And a perfect example is the video I just showed you of the guy that was killed when the police came out, even though when the call was made to 911, the family specifically requested psychiatric, it was for psychiatric call evaluation. But the police came out because at the time they did not have specific services for mental health and for uh, 911, if that makes sense. So now they have enacted this new number, 988. So, you don't have to go through 911 no more. And just keep in mind that number will become active in July. So, as time comes, gets closer, I will give you more information on that. I just want to be a source of information, share things with you that you might not be aware of. Okay, so let me keep on. Let me just make sure I don't have any messages. Okay, so let me go back. All right, where was I? All right, so let me get through this. Um, so it says, where did we stop at? Using this model, we did read that. So using this model, the regional or statewide crisis call center triages a call and dispatches the mobile crisis team unit to respond to an individual in crisis. So the crisis teams are comprised of qualified professionals, mental health professionals that are trained to de-escalate and treat individuals in crisis. And then they're, instead of going to jail, like I mentioned earlier, they are sent to well, instead of going to jail and emergency departments, because some individuals, the wherever the police, law enforcement decides they need to go. Some would go in the past, some would go to the emergency departments, and some go to jail. But with this new act, people that are in access mental health crisis, they will now go to crisis receiving and stabilization facilities and other community-based treatment where they can get the help that they need. So it says they begin to shift away. Mobile crisis teams enable states and localities to begin to shift away from relying heavily on police, many of whom are insufficiently trained in behavioral health crisis, to other trained first responders. Approximately 7 to 10% of police contacts involve individuals with mental illness, which are very likely to result in arrest and incarceration. And it's usually for minor offenses. The primary police response to behavioral health crisis can criminalize and stigmatize mental illness and substance use disorder, and make it more likely that the underlying mental illness or substance use disorder remains untreated. So it says, why are states expanding crisis mobile intervention services? So it says even prior to the enactment of ARP, which is the American Rescue Plan, sorry. So it says, uh, even prior to the enactment of ARP, a growing number of states and localities were reorienting their crisis response systems to include mobile crisis intervention teams and connect individuals in crisis to follow up behavioral health treatment and recovery services. So basically, they had started to put this in place, but now it's a whole act that has been passed to help the states to uh, sufficiently put this into place. Um, the mobile crisis state option is one critical tool available beginning in April 2022. So it's here now to invest in comprehensive and integrated crisis infrastructure that will, so it's going to stabilize individuals in crisis, connect them to follow-up behavioral health services, reduce the stigma associated with behavioral health crisis, and lessen the reliance of communities on police as first responders. Investing in a comprehensive crisis system that prioritizes behavioral health treatment can also help states and localities better support individuals residing in under-resourced communities who are less likely to be diagnosed with a behavioral health condition and connected to treatment. The option can also augment states' efforts to ready their behavioral health crisis systems for the establishment of 988, it's the National Suicide Prevention and Mental Health Crisis Hotline, in July 2022. As I mentioned earlier, that this new line, so when you or your loved one, if they're either needing mental health or suicide prevention services, you will now call 988. As you know, in the past, we only had 911. That's the only number basically that was there to call, unless you were calling like a hotline. But this is the new number. This number was just established, and it will be available July 2022. So, in the past, if a loved one or yourself was in active mental health crisis, of course, even though wasn't the it wasn't the something that you really wanted to do, but you had no choice but to call 911 because that was the only number available. But now, beginning July 2022, it's the number 988 that you will call if for national suicide prevention and also mental health crisis. Uh, and like I said, begins July 2022. Okay. Begin July 2022, states must have systems in place to route and address calls that come into 988. So that's like next month. What are key state questions? Let's see. Let me see. Okay, so it says, what are qualifying community mobile crisis intervention services under ARP? So it says ARP defines qualifying community mobile crisis intervention services as services that are available continuously and provided in a timely manner by a multidisciplinary mobile crisis team. And this is comprised of at least one behavioral health professional who can conduct an assessment, right? Um, as well as other professionals or paraprofessionals with appropriate expertise in behavioral mental health crisis response, which could include nurses, social workers, peer support specialists, and others. So it says at least one behavioral health professional, as well as other professionals or paraprofessionals with appropriate expertise. So that's already two people. I don't see the law enforcement uh, listed yet. And also trained in trauma-informed care, de-escalation strategies, and harm reduction. Provide screening and assessment, stabilization, and de-escalation in coordination with health, social, and other supports as needed. And maintain relationships with relevant community partners, including a range of medical, behavior, and crisis providers. So this is what mobile crisis intervention services look like, and I'm pretty sure this is at the very minimum. So it says, what are some of the promising models for crisis mobile intervention services? There are a number of different crisis response models operating across the country. They are funded through a combination of Medicaid, state, and other funding, and which leverage different professionals based on community needs and workforce capacity. There are useful models for states to consider as they seek to develop community mobile crisis intervention services consistent with ARP service definition. Give me 1 second to get it. Okay. So I say so. These are useful models for states to consider. So I guess if the state has not at this time um, implemented a model, has not implemented a model for these mobile intervention services. I guess this is like a model that you could possibly use. But I'm not going to go into that because I'm here for the community in the states. They're going to have to research that information there themselves. Hold on, I think I have. Let me stop sharing. I think I have someone that wants to start on a listen. Let me see if I can send. Let me see if I can send it. One second. Someone's trying to join. I'm trying to send them a link. So if I saw music for a second, I'm trying to send someone the link. All right. Sorry about that. So, okay, yeah. So the last thing we left off on is um, talking about how the state can implement this crisis center model. But I'm not going to go much into that because the states are going to have to do their own work, right? So I'm not too interested in that. Okay. So now we are going to. So I think that's about it. Okay. So this will be kind of important. Let me cover this. Let me share my screen. Emojis is something I know. All right, let me share the screen. All right, let me go back to the American Rescue Plan. And then, like I said, this is the American Rescue Plan, so it's all over the internet. If you want more information, you can of course go do your research about more about if you needed more about it. So I'm just doing an overview, so I'm not getting too deep into it, but I just want to let you know that this plan is out here. It's the American Rescue Plan, and that's this live as well as my other lives. My main goal is for individuals to do more research. So I want to bring you the information, right? But I only have a certain amount of time. So once I bring you the information, that gives you something to have that you can go further and do your own research and see how just do your own research and find out even more information about it. All right. So let's see, I might get the right here. Okay. So now we're talking about which populations are eligible to complete community mobile crisis intervention services. So it says states appear to have broad flexibility under ARP to tailor eligibility for community mobile crisis intervention services to any Medicaid eligible individual who is experiencing mental health or substance use disorder crisis in a non-facility setting. So what I'm reading so far, it basically states that to anyone that receives Medicaid and is having a mental health or substance use disorder, and they're not like in jail or in a hospital already. So that's what I'm reading so far. So let's keep going. Most crisis services, including mobile crisis intervention services, are geared toward treating adults ages 18 to 65. This means that crisis supports are often lacking for special populations, including youth, older people, and individuals with co-occurring intellectual um, and developmental disabilities. Let's see, who experience behavioral health crisis. So basically, according to this, it is it's lacking for individuals who have not only having mental health crisis, but also are experiencing also have intellectual and developmental disabilities. So as of right now, it looks like it does not target the population. That's what I'm reading as of right now. Let's see. To address the growing behavioral health crisis needs of children and youth, states can consider designing youth-specific models. So, like I said earlier, it is a lot of flexibility. Let's see, as we read right here, they have broad flexibility. So the states, if they choose to, let's see, if they chose to, they could design youth-specific models to include those youth that not only are having an active mental health crisis, but also have intellectual and developmental disabilities as well. So that might be something you can advocate to your state. Um, let's see, mobile. Where are we at? For example, Massachusetts Behavior Partnership provides child-centered and family-driven mobile crisis intervention services for youth who are aged 20 and younger through its emergency services program provider. Mobile crisis intervention teams comprise of master-level clinicians with family and youth-specific training and la- I can't talk, bachelor's and paraprofessional staff meet clients in home or school settings and work with youth and their families to de-escalate crisis events, to avoid treatment in hospital settings and out-of-home places. Individuals with IDD, as you recall, extensive intellectual and developmental disabilities are more likely to be not diagnosed with a mental disorder than other individuals, yet disability-specific crisis supports are often lacking in population. A number of states, including Tennessee, cover behavioral health crisis services for beneficiaries with intellectual development disabilities and co-occurring mental health disorders who are receiving long-term services and support through Medicaid waivers. It says TennCare in MCOs, Medicaid, I don't know what that O stands for, provides behavioral health crisis prevention, intervention, and stabilization services for enrollees with intellectual or development disabilities receiving managed long-term services and support, which include person-centered prevention and crisis prevention planning, training to caregivers, development of community linkage and cross-system support, and 24/7 crisis intervention and stabilization response. In addition, states and communities may also incorporate intellectual developmental disability training as part of their crisis training for first responders. Okay, so it says today there are also significant barriers for assessing culturally competent mobile crisis intervention and other crisis services for Black, Latino, and LGBTQ populations. New ARP funding provides states the opportunity to design new or enhance existing community mobile crisis intervention services to be inclusive of the needs of these and other populations of focus. So they do have the funding to either design new or enhance existing community mobile crisis intervention services. So if your state is not offering that, or if you have been in a situation and you notice that was not offered to you, I think at that time you need to start becoming an advocate. You need to advocate for your services because the funding is there. So states can cultivate culturally competent mobile crisis intervention excuse me, by ensuring that crisis providers have an awareness of historical trauma faced by under-resourced communities, as well as mental health stigma, which can act as a barrier to assessing behavioral health care for key populations of focus. Okay, so there is that. So, um, so what did you think about that information? That was a lot of information, right? That was a lot. My thoughts on it is that a lot of these acts or plans that are being passed, I think uh, a lot of communities just don't know about this. So I'm just going to encourage you. I know this has been a lot of information. I just going to encourage you to go back and look at all this information again because basically in this video, it's telling you that they have passed a new act that was uh, went into effect April 2022 that they have mobile crisis intervention services. Instead of going to jail, they have they have mo- um, mobile crisis intervention services so that individuals that dealing with an active mental health crisis, or it doesn't even have to be active, to get services instead of being hauled off to jail. All right, so all right, so let's go. Let's keep going. We're almost done. So we're done with the American, and like I said, it's called the American Rescue Plan. Just in case you need more information on it. So next, what we're gonna do. Okay, so next we're like just in case you are aware. I mean, you aren't aware. I am in South Florida. So I just want to share some information about my specific state where I'm at. All right, so here we go. Okay, so this is Florida. It says, getting your loved ones. This is from Treatment Advocacy Center. Treatment Advocacy Center. And you can look, this is from by state. So, for example, if you don't live in Florida and you wanted more information, you look up treatmentadvocacycenter.org and you just can do your state. I just did my, I did Florida where I'm currently living. So, I'm from Georgia, but I'm currently living in Florida. So let's just see what it says. Get your loved one help in Florida. In a psychiatric emergency, the more you know about your state laws, the more you know about your state laws and treatment options, the better prepared you will be to respond in the most effective way possible. These resources will help um, says essential information on who may initiate proceedings leading to mandatory training. Let me just make sure my screen is big enough. Nope. Oh, let me just bigger. To make it bigger. There we go. Okay. Okay, so it says getting your loved one of help in Florida. It says the more you know, the better prepared you will be to respond in the most effective way possible. Okay, so let's see. I didn't click on this the first time. Let me see if it's something. Okay, so this is just gonna be the standards for everyone. Like these are your laws. So, like I said, if you, I won't go too much into this information. I really don't have the time. But if, like I said, you can always go on treatmentadvocacycenter.org and just go to the bottom and you will see your state. And you can show you the information. I'm just gonna briefly go through this. It also will give you the state for emergency hospitalization for psychiatric evaluation. Um, so this is the estimated prevalence of severe mental illness in Florida. This is for 2020, which I hate to say it, but I'm pretty sure it's high now because mainly because of the pandemic. So I don't, I don't have any information at this time to say it's higher now, but I'm pretty sure it is. And so then it goes into mandatory treatment laws in Florida. Like every state, Florida has civil treatment laws that establish criteria for determining when involuntary treatment is appropriate for individuals with severe mental illness who cannot seek care voluntarily. Uh, Florida laws allow for the use of court order treatment in the community, known as assisted outpatient treatment. Excuse me. So it is not found. And that might not be in effect anymore due to the new law that was passed April the 22nd. I mean, April the 22nd, April 2022. Because when I click on the page, and it was just something. Like I said, I'm briefly going through this information. So if you wanted more information about it, I gave you like uh, time to just go back and look at it for yourself. And this is Florida state laws outpatient commitment statute, and then part two, outpatient commitment statute. Both had a 30-30 total 66. They got a D. Public psychiatric beds in Florida. A minimum of 50 beds for 100,000 people is considered necessary to provide minimally adequate treatment for individuals with severe mental illness. Like every state, Florida fails to meet this minimum standard. So let me just read it again. Like every state, Florida fails to meet this minimum standard. And if you were looking at if you looked at the live about the Community Mental Health Act of 1953, this kind of so that live will basically tell you how we got here. So if you have not checked it out, it's the part one and part two. Part one and part two. Community Mental Health Act of 1953. And that will bring you here because around that time, that is when they started closing the psychiatric hospitals. So the people who were experiencing, these crises were either going to the emergency department, going to jail. They were no longer able to go into the hospital. So let me just read this. So beds in 2015, 2,648, 2010, 3,321, and then so they lost 673 beds. So this is just all the information. And now they're going to talk about criminalization of mental illness in Florida. Like every state in the nation, Florida incarcerates more individuals with severe mental illness than it hospitalized. So, for example, in 2000, and these are a little older numbers, so I'm pretty sure it's higher now. So, this was the total inmate population in 2005, 148,521. Uh, these are estimated population of severe mental illness, 23,763. So that's 23,000 people that have severe mental illness that instead of was hospitalized, they were sent to jail. So just keep that in mind. That's 23,000, almost 24. Total psychiatric inpatient population, 4,826. So these are 23,000 plus are the ones that were sent to jail, and 4,826 or is the population that were actually sent for psychiatric inpatient. Okay, I'm starting to have a guest. Hi, KB. How are you doing today?
Hi.
Thank you for joining us. We're coming to the end, but I'm so happy to see you here. You have any questions?
Not right now. I love your content
Okay.
today.
Well, thank you
Thank
so much. Thank you for joining us. Like I said, we're at the end, but if you have any questions, please don't. Please feel free to ask. But if not, I'll go back to the content. I'm just gonna leave you up. You know me? I'll leave you up. I'll put you on mute. You can always unmute it. All right, so let's go back. Where were we? Um, okay, so that shows you. So we had a total inmate population 2005, 148,521. Like I said, it's been a few years back, so I'm pretty sure it's higher than this now. And those, out of that population, 23,000, almost 24,000, have severe mental illness. Instead of instead of the ones with severe mental illness, almost 24,000 of them being taken to psychiatric inpatient, they were taken to jail. So that again shows why these crisis mobile intervention teams are going to be very helpful if all the states decide to enact them. Because after this, I'm going to show you exactly what states actually have the crisis mobile teams enacted. It's not all the states, even though they have received funding to uh, enact this plan from the American Rescue Plan. They have received funding. So if your state is not received, does not have this in place, I would, I would suggest you start making some phone calls, even become an advocate, because they do have the funds for this. This plan, American Rescue Plan, that allows for states to have mobile crisis teams come out instead of law enforcement when someone is in active mental health crisis. This has been out since April 2022, and it's supposed to be available to all states. Even though you will see, once I'm done with this, I will show you that all states do not have this as of yet. Okay, so what is this? Criminal diversion in Florida. Okay, so it says criminal justice officials are responding to the criminalization of individuals with innovative programs designed to divert individuals with severe mental illness away from the criminal justice system. So these are the two programs right here: mental health courts and crisis intervention training. So they have 67% being served by mental health court. So that's good. At least they do have a mental health court. Percentage of population served, uh, 97%. So they get an A on this. So, like I said, I just wanted to go through this so you'll have information to why this the American Rescue Plan is so it's it's monumental. First of all, it's going to be so beneficial to states, and we just need it. Look, this is the people that have been placed. Oh, let me get back to that number. So, criminalization of mental illness. So, these 24,000 people right here should have been, instead of being locked up, they should have been uh, given some type of assistance, right? Because they have severe mental illness, right? And we have to stop criminalizing those that are dealing with this type of thing. They need assistance. All right, so there's that. Let me stop sharing my screen. Let me see if anyone has any questions. All right. Okay. So let me go back. And we're almost done. I know we've been here for a while, so we're getting ready to wrap it up in a second. Um, okay. I got this. I already got this. Okay, so next, I'm just gonna briefly go over our state's um, model of what mobile crisis intervention looks like. So let me share my screen. So this is our model. This is for Florida. This is for Florida. This is from the Center for Progress Excellence Mobile Crisis Unit. The crisis number, so they have the number right here, and it isn't for our Florida. Doesn't seem like. So it says the goal of for the mobile crisis response team is to reduce the number of involuntary maker acts to at-risk crisis intervention techniques in Florida Circuit 20. So it's not going to be, it doesn't even include me, but it is Florida Circuit 20. But this just gives you a kind of outlook on what the mobile crisis unit does. And anybody, the involuntary Baker Act is basically when you're going through a mental health crisis if you're taken to a hospital for like a minimum of 3 days just to get you stabilized, and then you return to the community. You're able to start medications if you're not on any, and therapy. So that's basically what a Baker Act is, and I will talk more about it in a later live. Let's see. The Mobile Crisis Response Team (MCRT) consists of case managers, peer specialists, master level clinicians, and licensed professionals on shift each shift. MCRTs are on call 24 hours a day, 7 days a week, to ensure the safety of the community. So I'm just going to go into, and like I said, this is specific to Florida, and more specifically to Charlotte, Lee, Collier, Henry, and Glade County. So this is some cities in Florida. Now, but I just want to give you a overview on what it looks like if your state has a mobile crisis unit. So it says it provides the following services to the community: 60-minute response time to the crisis location if the individual is having active suicidal or homicidal thoughts and or ideation. It provides a safety assessment. It's an evidence-based suicide assessment. It stands for Suicide Assessment by Self-Evaluation and Triage. Services linkage within 48 hours of intervention. So within 2 days, you will be referred to a therapist, psychiatrist, to start medication and any other services that are deemed necessary. Wraparound mental health services with assigning a peer specialist and a case manager to each client. So you're going to have a peer specialist. And if I'm not mistaken, I think the peer specialist is more in the community, so they have not necessarily been through schooling, but they are more like going to be like the peer, and also a case manager. 30 to 45 day peer specialist intervention, 30 days follow up with a case manager for 120 days, and outpatient counseling utilizing a sliding scale fee. So this is what is all included in this model, mobile crisis unit. And then it's just telling when should you call. Suicidal thoughts, thoughts of self-harm, increased symptoms of depression, increased anxiety or panic attacks, feeling overwhelmed and don't know what to do, and support for life stressors that are negatively impacting your mental health. Okay? So, so there's uh, just a model in our state, what it looks like in our state. So, let's see. That's what we're going to do, and then we'll be done. What we're going to do now, I just want to briefly go into the other states models. I mean, not really go into the other states models. You will have to do that homework for yourself. Like I said, if you have the thing in my life, I try to assign this a little with the homework just so you can further the conversation and further the research. I am a therapist, so I am used to assigning homework. So we have the next thing we're going to show, and the last thing, I'll get on here for a while, is what states offer this service. Okay, so let me share my screen. Here, ready to wrap it up. Okay, so this is from let me just go back to the top. This is from Black Emotional and Mental Health Collective. So it's called BEAM dot community. Um, BEAM dot community. So it's just giving y'all a type of numbers on here, and you're more than welcome to go back and get these numbers if you need it, or you can just go to the website itself. Okay, so this is alternative alternatives to calling the police. Online directory, local resources available as alternatives to collect contacting law enforcement. So they have to visit the Don't Call the Police website. Let's look at this together. Okay. So and keep in mind now, I'm not telling no one don't call the police. But this would be if someone with an active mental health crisis, there's no need to call the police because they are. So it's no need to call the police because they need assistance, right? They need to be stabilized, and like we were mentioning earlier, many times the police or law enforcement is not trained, right, in mental health issues. That's what it is. All right, so let me share my screen. And we were looking at the Don't Call the Police. Like I said, this is my first time doing this. So we'll just go through this. So this is the Don't Call the Police platform. And it has all different states. It looks like states are on here. Some of our major cities and states. So they have quite a few. Let me just click on one because, like I said, I never heard of this site before. So let me just see if we have one in Florida. So it looks like the closest one is going to be in Orlando. So let's see what it's Find alternatives to call. Police department typically people call the police because they're experiencing or perceiving an emergency and need immediate assistance. In order to provide the most effective alternatives to calling the police or 911, unless otherwise indicated, the resources included here are limited to those that offer immediate assistance to emergency or crisis services. So these resources may be obligated to call police in a case of an immediate risk of harm to the caller or another, child abuse, or abuse of a vulnerable adult. Well, we know or suspect that a resource may work in cooperation with law enforcement or involving beyond what is required by law. We acknowledge that in a list. So this says these resources are not intended to cover all situations, only to provide the services described. If you are in danger of immediate harm and feel safe doing so, call 911. So let's just click on one just to see. Let's do mental health. So if you click on mental health, it tells you. So of course, if you're having a mental health issue, so we're not saying don't call the police if you're in danger or anything like that, right? Of course not. So let's just stay together and I'm a mental health professional, so of course everything I did is going to be related to mental health. So when they say don't call the police, it's basically saying if you're in at the mental health crisis, so you don't even have to be afraid about receiving assistance, right? Because from someone who may not be even trained in mental health issues. So it says these in Orlando, mobile crisis services are available to anyone 80 to 24, located in Orange, Escala, Seminole County at the time of crisis. So they will send out a master level and licensed therapists who respond to home schools or anywhere within the Tri-County community within 60 minutes to provide immediate on-site crisis stabilization. Crisis therapists also connect families to the services and support they need for long-term recovery. So like I said, I just did this, and they have all of these here. And I'm pretty sure if you click on some of these, like for example, let's do you. It all depends on what's going on. You will have to call the police, um, as well as others, and as well as crime. So you probably would just be focused on this on mental health issues if we were going to one of these services. And like I said, I went to Orlando because this is the closest thing to my city, but they have them listed in a lot of major states. It says don't call the police.com. Before you judge the book by its cover, just go, you know, this is the first time I'm seeing this as well. So to go, check out the information and see self-assistance to you. All right. Stop sharing this. Okay, so the final thing I'm going to do is I'm just going to give a list, well, briefly state the states that are currently offering these services. Okay, so it says mobile crisis intervention. So it says mobile crisis units. Mobile crisis or mobile crisis rapid response team or mental health service which supports the community by providing immediate response, emergency mental health evaluation, and crisis services in the United States. In many areas, they offer an alternative to calling 911 or the police. Some mobile crisis units may also inform the police. And that's okay. It's okay if they inform the police, but you just want those two, you want a team to come out instead of just the police. You want a team, you want a professional that's equipped in handling mental health issues, right? And also the police as well. It needs to be a team, which looks like what you're trying to build now. So here are the different states. As you can see, we have like over 50 states. So let's see how many states are actually involved right now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. So 17 states we have. I'm not going to go through them because you see them right here. So if your state is not listed here, I would advise that you start first of all doing more research just to see, because this is not all inclusive of everything, right? This is the overview. So you will want to go research your city to see, uh if they're not listed on here, see, do you have it? Maybe they're just not listed. Maybe you do have it but they're not listed on here. And then after doing your research and seeing that it's just not, that it's nothing available for your state, I would suggest to begin advocacy about that. Start reaching out to see why, because all the states have been given funding to enact the American Rescue Plan, which includes enacting these mobile crisis units. So that means all states um, should have it, and that was as of April 2022. So if your state does not is not providing this type of services, I would want to ask why. What? Why? Because you never know. You might never need the service, right? because you never know if someone, your loved one, or friend, whoever it may be, could need the services. And like I said, it has been a whole American Rescue Plan passed, you know, by the government that allows for this mobile crisis unit to be in your specific state, in your state. So if you don't have one, I would start asking questions. Why not? All right, so I'm done. I was here longer than I thought I would be, but I hope I shared some valuable information. Just for one, to just get the conversation going about, first of all, mental health, because I talk all things mental health. You will never know what I will be talking about for today. You have to tune in, but it will always be talking about mental health. So this is about the mobile crisis team, and I hope that the information did provide a outlook that information that you did not have before. So I'm gonna wrap it up now. I have to go on with my day. I hope you enjoyed. I hope you catch my next live. I hope you like and subscribe to. Let's see. I'm gonna share it up here. On YouTube, you can find me, your favorite therapist, Lily Doobie. And please like and subscribe my channel so I can get information out as I talk about valuable resources in the community, valuable information for the community, all things dealing with mental health. We need to break the stigma when it comes to talking about mental health, especially in the Black community. So please like, share, subscribe to my channel as I just continue to bring more information on this topic. All right. Well, have a blessed day. Thank you. Bye bye.